We have a good number of people. So welcome everybody to Grand Rounds. I am the guest introducer because I lucked out and Gigi let me invite Tracey Woodruff. It didn't take a lot of convincing,
Oh
but
my God, that didn't really sound all that awesome, by the way.
no, she
I
was
didn't like
totally,
that.
everybody was on board. It was like, oh my
Yeah.
gosh, yes, what an obvious
Right.
idea. We should have had her years ago.
Yeah.
So anyway, I'm going to introduce you and then I'm going to make a couple of personal remarks and then I'm going to turn things over to you, Tracey, or Dr. Woodruff. So Tracey Woodruff is the Alison S. Carlson Endowed Professor and Director of the Program on Reproductive Health and the Environment at the University of California, San Francisco Department of Obstetrics, Gynecology, and Reproductive Sciences. She has a lot going on, but she's also the director of the UCSF P30 Environmental Research and Translation for Health, or Earth Center, which I think is a very creative acronym. She is a widely recognized expert on environmental pollution exposures and impacts on health with a focus on pregnancy, infancy, childhood, as well as health equity. So before Tracey was at UCSF, she was at the EPA, which is where I first met her when I did my postdoc in the Office of Policy at the National Center for Environmental Economics. And it was amazing to see her. She had just left and just gone to UCSF, but we had a chance to interact a little bit there. So many cool things about Tracey. She's a current member of the NASM Board on Environmental Studies and Toxicology Standing Committee. She is a member of the Cochrane Library's Editorial Board, and she was appointed by the California governor. And I checked, was it the governator? And it was not. It was right after the governator.
No, it was
Yeah.
Jerry Brown, our
Okay.
most awesome governor. Jerry Brown 2.0.
Okay. Yeah. No, that's better. That's much better.
Yeah.
She was appointed to the Science Advisory Board of the Developmental and Reproductive Toxicant Identification Committee. I could go on all day with her accolades.
We're not going to do that though.
We're not. We're in
No.
a hurry.
Yeah.
A little detail that's very relevant to our department is Dr. Woodruff is trained as an electrical engineer and in computer science. So
Yeah, I know. I told you not to say that though. Way back.
I know, but there's a reason. There's a reason. We're a merged environmental health and engineering department. We're somewhat unique in that way, and we love people who understand and can bridge the two sides of our department. And you're one of those people, even though we're not going to push too hard on that. You are an amazing real world example of someone who understands and actively bridges those pieces. I'm thrilled you're here because you're a longtime collaborator, friend, and frankly, an inspiration. As I'm sure you're going to be talking about today, one of your primary foci is the translation of science to inform public health policy, which is so important. Even now, when things look really grim, it's still super, super important. Tracey has led training programs and consortia that involve coordinating scientists, practitioners, and advocates to make a case for evidence-informed change. Your work at PHRE and really throughout your career is a model for how we can and should make sure our work actually matters and accomplishes something. Last thing, Tracey's a musician, as evidenced by the guitar in the back of her Zoom room, and I'm sure she'll have at least a handful of slides on using music to make change. All right, maybe not, but it's still very cool nonetheless. Anyway, Dr. Woodruff, welcome to the Bloomberg School. We are looking forward to your talk. Before we get started, I just want to mention for our trainees that are here, if you're interested in meeting with Dr. Woodruff, she's able to stay, I think, until about 1:30 after her talk, so just stay on this Zoom. Thank you for doing that, Tracey, but otherwise, we are looking forward to hearing from you.
All right, great. Thank you, everybody. And if you want to put your names in the chat, and I'm really curious about where you get your news, because I think we have an age range here, and I will tell you later where some of the places we've been thinking about in terms of communicating science, because that turns out to be kind of a challenge that we are having as a group. So, okay, some of it's going to be typical, I know, but some of it's not. So I know you can see my slides. So I'm going to talk about toxic chemicals. And I just want to say I would have liked to have been there, but your 3-hour time difference is a little daunting. But anyway, the other thing is that I made the title for this talk before the election. So I just want to say I would kind of predicted what was going to happen. Not really, but we'll just move on. As Keith said, I'm the director of the program Reproductive Health and the Environment and the UCSF Earth Center, and I have no financial disclosures to declare because I have no financial conflicts of interest. And the goal of our work is to create healthier environments and to improve the health of people everywhere. So I'm going to talk about the work that we do in terms of targeted research, how we translate that into improved clinical care and just public policy. So I know that you all are familiar in this topic area, but I think it's good to step back and do a review of all the ways that we need to be better addressing the increasing rise of toxic chemical exposure and how it's impacting our health across the United States and globally. And so we know that there are chemicals in air, in food, in drinking water, and all the various products we have in our home, and they are contributing to illnesses that we're seeing in the population. And one of the things that we have been working on at UCSF in our communications is being more clear about toxic chemical exposures and the role in making people sick, because it's really important for us to acknowledge all the amazing science that everyone has done and that we continue to do. So chemical production has increased dramatically since the 1950s. People have heard me, we have this very common slide that we feature in our talks. And I think it's really important because it mimics the increase in chronic diseases that we see across the population. And these should be familiar to you from your department. Things like PFAS, flame retardants, plastic-related chemicals like phthalates and BPA have all increased dramatically. But I think what's really important and something that we have been talking about more is that, and for which we have very good data, and I'll talk more about this at the end again, is that what we're seeing now is that the largest global burden of chronic diseases is from fossil fuels, plastics, tobacco, toxic chemicals, and ultra-processed food. It's about between 30 and 40% of the global burden of disease is these products that are produced by corporations. And so one of the things that I'm going to talk about at the end is the role, what we're looking at in terms of, we deal a lot with environmental chemicals and toxic chemicals that come from fossil fuels, but how do we think really about moving upstream and addressing the corporations that are making these toxic products? And so these are also estimates from the global burden of disease about increasing rates of a number of different chronic conditions, including Parkinson's, Alzheimer's, dementia, diabetes, cancers. And indeed, what we've seen is a shift just since 1990, which I think is pretty remarkable because some of us were reasonably well established in our careers at that time. But it used to be that the biggest infectious diseases had the highest share of the global burden of disease at 46%. But what we've seen over time is that chronic diseases have overtaken communicable diseases and are now 64% of the share of the global burden of chronic disease. That includes cancer, respiratory, cardiovascular, neurological, metabolic disease. The point being that what we're seeing now is a lot of focus in the government and research programs has been on infectious diseases, while this other, and it's not even emerging, this trend has been increasing, and we need to refocus on external factors because those are the drivers of this. It cannot be genetics given this short period of change. I'm just going to point this out. The Lancet Planetary Health has done 2 papers by a group of experts on pollution and its contribution to mortality globally. And air pollution is the largest risk factor for global mortality. And I want to emphasize that this is the update, which was published in 2022, and that there's a lot of great data on air pollution. I know a lot of you do work on air pollution, but that we actually only have very little data on other types of pollution, including hazardous chemical pollution, which I'm going to focus the rest of my talk on. And that in this report, they said a lot has not changed since they published this previously, I think 4 years or 5 years previously, and that we still have a lot to do to prevent this burden. So I'm going to talk about petrochemicals or environmental chemicals, which is the focus of our work at UCSF and at work that I did at EPA, which I'll talk about at the end. So I do want to emphasize that petrochemicals are made from fossil fuels. I think we don't talk about this enough because, again, if we're thinking about what's the upstream contribution of these chemicals that we deal with every day, we can look at more efficient ways to control the source of these chemicals in terms of preventing adverse health effects. And so the other component of this is that there is a life cycle of fossil fuel production, both the natural gas, and I think this is a really, and I know Keith has done a lot of work in this area because we're seeing increase with the advent of fracking around 2008 and the dramatic increase in fracking, which has led to a dramatic increase in plastic-related production. We're seeing that there is exposures all along the, in this case, the plastic life cycle to these chemicals, starting with the fracking or the natural gas extraction, and then it's made into these various intermediate products, which turn into all the various products that the chemicals that are used in all the various products in our lives. And exposures can occur both people who live near these facilities, people who, whether they're producing it, transporting it, or disposing of these materials. So I think the other thing that people don't realize is that ethylene, which is the feedstock for these chemicals like PVCs, vinyl chloride, styrene, polystyrene, that then turn into various different types of chemical products or plastic-related products, it's more lucrative for ExxonMobil and these fossil fuel companies to sell them for to be used in making plastic than it is to sell them for fuel, heat, or electricity. And I think the other thing that people don't realize is that so they're shifting their markets because this may change a little bit, but as more regulatory activities come into play to change the use of fossil fuels, so you see more electric cars, more houses and buildings are being managed with electricity, that the fossil fuel companies are looking for new markets, and that's why they're switching over to plastics. So, and that petrochemicals are becoming the largest driver of global oil consumption, and it will account for 1/3 of the growth in oil demand in 2030 and nearly half in 2050. So what we're talking about is ExxonMobil is also the biggest maker of phthalates and plasticizers. And so we're going to be seeing an increase as they shift from using fossil fuels for cars and heating and things to this plastic and other petrochemicals, which will result in more exposures to the population. So to give some context to this further is that EPA up until recently, we'll see how this goes, but EPA does collect information from industries about how many chemicals they're producing or importing per year. And this results, it's about 9 trillion pounds, which is about 30,000 pounds of chemicals per year that is produced for each person in the United States. So that is a lot. And inevitably, it makes sense that we're all exposed to many of these different chemicals, and you are familiar with some of them, which are PFAS and flame retardants and these plasticizer chemicals. So, and we know from many different studies, biomonitoring studies, that these chemicals are used in these products, and then we are then exposed to them. A lot of our work, for example, at UCSF focuses on looking at exposures that occur during pregnancy, and we focus on pregnancy for several reasons. One is it's a really important time for fetal development, which can set the trajectory for health throughout the life course. It's very sensitive. It can be uniquely sensitive. And so we want to understand the role of these environmental perturbations and how they can influence both infant, child, and adult health. But also, if we are looking to reduce exposures, if we're looking to reduce risks, which means reducing exposures, and we want to reduce it to protect those that are most susceptible, doing it to ensure that the prenatal period is free from these health risks is going to be the most efficient, because if you set the regulation or the bar to protect those during pregnancy, you will therefore protect everybody in the population. And we know that these chemical exposures are taking a toll on our health. I talked previously about adult chronic conditions, but we're also seeing growth, increases in chronic childhood conditions, whether it's autism, childhood cancers, behavioral disorders. And then we're also see effects that are measurable on birth defects, low birth weight, infant mortality, fertility, it's remarkable how all these health effects can have some environmental component. And I just want to talk briefly about neurodevelopment before I talk about some of the ways that we focus on trying to address this problem scientifically and then from the policy perspective, because I think the increase in the prevalence of neurodevelopmental disorders is both really important for families in the United States, but also because it just shows how we need to do a better job about addressing these exogenous exposures, whatever they are, to because we're seeing these more prevalent conditions among childhood. And I picked this one here because from the childhood autism prevalence from the CDC, the Autism Developmental Disabilities Monitoring Networks, because since 2000 they've been using similar diagnostic criteria across different sites in the United States. So there's less influence in diagnosis than there is if perhaps you're looking at the National Health Interview Survey, which also asks people about whether their child has autism. And you can see since 2000, there's been a dramatic increase in the diagnosis of children with autism. And that what's interesting too is that you're seeing an increase in the Black, Hispanic, Asians now have more reported autism, or diagnosed autism than white children. And we're also seeing concurrent increases in ADHD. And I want to just briefly talk about that. One of the challenges, I think what's been very interesting about the change in administration, I mean, there's a lot of things that are kind of scary, but one thing that's been very interesting is how much leverage they have been getting off of this Make America Healthy idea. And I feel like that we have not done the best job in talking about institutionally about why the environment, particularly around environmental chemicals, matter for some of the health effects that families are personally feeling in their own lives. And I think this paper by David Bellinger, which is albeit old, but still relevant, where he basically standardizes different risk factors for decrements in IQ and then calculates the IQ loss across a population, the hypothetical population of children. But you can see here that medical conditions, which the clinical community deals with all the time, preterm birth, yes, that can result in IQ loss, or neurodevelopmental disorders, they would recognize as linked to IQ loss, or social economic factors like failure to thrive. They have important and recognized effects on IQ, 34 million for medical conditions, 38 for neurodevelopmental disorders, 15 for these. But really the environment is actually bigger. And this is only just methyl mercury, organophosphate pesticides, and lead. And we know there are many more chemicals that adversely influence IQ. For example, exposure to PBDE flame retardants. And those are bigger than what the medical community recognizes as risk factors. And so I think it's not that we don't have enough science. We have a lot of science. And that's what I want to tell people. We have plenty of science. We need to be communicating how strong our science is for things, or where there's uncertainty in the science, but that this is a problem that needs really to be elevated in terms of addressing. So the big challenge is that we know a lot about a few chemicals, really. As I said, there's 9.5 trillion pounds chemicals produced per year. I'm going to focus on chemicals that are registered under the Toxic Substances Control Act. That's the major legislation in the United States that is meant to address chemicals that are manufactured, produced in the United States. There's about 40,000 chemicals on the TSCA inventory. We have about a very small fraction of them are biomonitored, or do we have information about their health effects. So we're really, really far behind in terms of addressing either understanding where they're being used or their health effects. And I'm going to say this again and later, and that is because the laws in the United States are set up so that the chemical companies do not have to tell us where all these chemicals, these 40,000 chemicals, are being used, nor evaluate these chemicals that have been growing in their use, what their health effects are. So that means we are in this cycle of playing catch up and also basically doing a postmortem on the exposures and health effects in the population. So like I say, is we have a really wicked problem. We have an embedded chemical industry and a lot of chemicals, and we know there's health effects, but we don't have a lot of information. So here's what we have been doing to think about how to address this, because this is a big problem. Like, how do we even conceptualize where to start when we're trying to figure out how to address this problem? So I think the exposome has been a very useful framework for us to operate under, which is to look at the environmental contributors to disease. And there's many different versions of this out there, but it's really the sum of all the factors that we're exposed to from conception onwards. And so whether it's where you live, your social environment, your physical chemical environment, or individual factors that you're exposed to. But we can talk about this later, but a lot of these individual factors are highly influenced by the social and ecosystems of where you live. So I like to make sure and say it's not just a habit. This is also when I was like, for example, we're looking at health effects from petrochemicals, we have to remember that there's the risk to these chemicals are in part due to whatever the intrinsic property of that chemical to adversely influence a biological pathway, but they're modified by many factors. And one of the factors that, or some of the factors that we have been evaluating that can influence the risk is these non-chemical exposure modifiers. And this comes up in some of the work we're doing in the policy arena, but things like your socioeconomic status, underlying disease, your age, your genetics, sex, nutritional status, these can all have an influence on your risk profile and can contribute to these adverse health effects. Okay, so one of the things that we're very focused on is how do we, because a lot of these exposures are really, most of them are beyond our control. How do we, and so there really need structural changes to ensure that we limit exposures that are harmful to us or to the public. So our research is very focused on informing systemic solutions to reduce harmful exposures, improve health, and to reduce health inequities, because these exposures contribute to health inequities. So when we've been we've framing our work around, like I said, there's 40,000 chemicals. How do I identify which chemicals to study? There's so many chemicals, there's susceptible periods of development, there's demographic differences. So this is one area that we've spent a lot of time thinking about. How do we focus what kind of scientific tools can we do to identify chemical exposures and prioritize them? And then how do we look at the overlap with social stressors? And then can we more efficiently move upstream rather than having to wait for these apical endpoints, these like observable endpoints? Can we look earlier in the biological process and use something like the key characteristics, which have been defined for many different health endpoints, which I won't talk too much about that, but can answer questions. So as I said, there's these 40,000 chemicals that are on the TSCA inventory, but I just want to note that EPA, well, EPA still has this, has that computational tox dashboard. Actually, this is an underestimate. This is an old slide. It says 883,000 chemicals, but there's over 1 million chemicals. And these are chemicals that are registered that are, can be used in other countries or other types of products. So there's a lot of chemicals. So when we've been doing work at UCSF, we've been thinking about, well, there's different ways to do. We really focus a lot on biomonitoring, and we can talk about that, but in the questions, but it's an area that we've been advancing, and there's been a lot of work done, or biomonitoring has significantly expanded in capacity over the last 20 to 30 years. A lot of it's focused on this targeted analysis where you say, okay, I'm going to measure a phthalate, and I'm going to develop a method, and then I'm going to go out and measure it in a blood or urine sample. So, but then there's also newer methods that allow us to screen, to do more of an agnostic screen for chemical signatures in biological tissues. So there's pros and cons. This allows us to get more accuracy on the amount. This allows us to look for things that we may not even know are exposures in the population. So we were part of the National Institute of Health Environmental Influences on Child Health Outcomes Consortium for a number of years. And as part of that, I helped lead the chemical work group where we had the opportunity to identify opportunities for biomonitoring within the ECHO consortium. And this was also when the HERE labs were still, I think they've been phased out, but the HERE labs were a set of labs across the United States that could do biomonitoring for different studies. You could apply to them to get to have them do biomonitoring for your study if you had samples, and they were serving as the biomonitoring arm for the ECHO program. And so what we did, which I thought was, really like, instead of just like picking the same old things that everyone else measures, we're like, well, what if we had this opportunity to really think through, are we measuring, like we know how to measure certain phthalates, we know how to measure BPA, we know how to measure, certain pesticides, but are those and certainly some of the cohorts were doing that, and we did an analysis of that. Jesse Buckley did a great analysis of that. But what if we had the opportunity to really significantly expand our capacity to move beyond those 300 chemicals and think about, well, what are the other chemicals we should really be prioritizing? And so this work was led by Ido Pellizzari. It was published in EHP, and we used existing databases to prioritize chemicals for biomonitoring that weren't being routinely covered, that also were more likely, that we had a high likelihood for which there would be exposures. So they were found in databases of drinking water, air, house dust, food, biofluids, or in different product categories. So EPA has the CPCAT database, which has different product categories, and you can look at consumer products. So we looked for chemicals that both had they were already in products, being used in products, or they were found in, food, drinking water, air. So we already knew there was likelihood of exposure. And then we used some other databases to identify what's the likelihood that they would be a toxic chemical for the health outcomes of interest in the ECHO program, which was, one of them was birth outcomes, airways, and metabolic disorders. And so we merged these two, so had a high likelihood of exposure, and then also were likely to be toxic to one of those endpoints based on either animal data or some of the computational tox data from EPA. And then we prioritize them based on, those two things and whether there was data to identify that they would be a high priority. And we came up with these different chemical classes. So it was included flame retardants, plasticizers, aromatic amines, which, I mean, to me, this was a really great exercise because aromatic amines, I never would have picked that. And yet it turns out that there could be some important toxicity from them. Some different PFAS, some pesticides, and then quaternary ammonium compounds. I'm not going to have a lot of time to talk about this, but this is a really important and interesting group of chemicals that I think deserve more attention. I'll briefly touch on that at the end. And it turned out we're collaborating with Kanan, who's now at Wadsworth, and he was able to develop a really unique panel that you could take a single spot urine and measure multiple chemicals in that spot urine. Also included, I wanted to also say we looked at melamine and aromatic amines in this panel. So we were able to use this panel that Kanan developed, which could measure almost 130 chemicals in a single spot urine. I mean, it kind of mapped a little bit across the ones that we prioritized, but they were in these different groups, including new phthalates, new plasticizers, pesticides, new flame retardants, polycyclic aromatic hydrocarbons. I mean, there's a lot more information that we had not had previously. And this is from the pilot study that we did. The larger study is coming out soon. But you can see there's a lot of chemicals that were detected in I think this is greater than 90% of these participants. I mean, it's only like, a couple hundred participants, but the point being that we're seeing things in here that we wouldn't have seen if we had just stuck with the same old things that we always measure. So we saw these aromatic amines and melamine, and I know I see Jihei on the call. She just done a lot of work with this data, benzophenones and paraffins, bisphenols. I just want to point out that something that I totally was not expecting was these neonicotinoid insecticides. I don't know if people know these. These are for, they were kind of replacing organophosphate pesticides. in this pilot study, we saw almost universal exposure to these. And I was really surprised because these people aren't living near agricultural areas. Some of them are probably getting it in their home. They can also be used on pet products. They've been banned in certain countries because they're can have contributed to bee colony collapse, like in Europe. So they're still used in the United States, though. New flavor retards and this polycyclic aromatic hydrocarbons. So you can see in this group that we're finding a lot of chemicals that we produce with. And then we were able to, again, it's not a very big study. I think we had like 100, a little over 100 people, but you can see that we can also compare, because the other advantage of the ECHO, it's a synthetic cohort. It's basically made up of individual cohorts across the United States that are kind of pooled together. But we had a good racial and ethnic diversity. I think it was 50% of the population was non-Hispanic, Black, or Hispanic. So, and then the remainder was mostly white. But you can see that we can also evaluate the extent to which certain groups have higher exposures compared to other groups. And in this case, you can see the red arrows up mean higher exposure compared to white counterparts. So there was higher levels of these bisphenols. So not just BPA, but also the substitutes, which is really interesting because it gives us information that, for example, BPA, has been a lot of people study BPA. State of California said it's reproductive toxicant, but then what happens is these companies switch over to BPA, the substitutes that are like chemically next door to them or their sibling, and then you see an increase. And we also saw an increase in time in these. Also parabens, those are personal care products, and then some of these neonicotinoid pesticides are higher in Hispanic populations. So this already tells us why, we have these chemicals, we can see these much broader spectrum of exposures. We're right now almost finished with the paper looking at these prenatal exposures and how they can contribute to adverse birth outcomes. But the other really important thing about this is now the data has been analyzed in over 5,000 pregnancies. So it's available to, and it's being made available to other researchers. So you can access this data and look at a huge host of other health effects that sequelae during childhood. So what it's saying is we were able to both have more important information about exposures during pregnancy, and we can add capacity to the field so that people can continue to analyze this to look at how these really chemicals that we never saw before in pregnancy are affecting future child health. So I just want to emphasize, if you're looking for a research project, I would recommend going in there, but Jihei may have more to say about that. Okay. So that's some work that we've done on targeted analysis. And like I said, the paper on the pregnancy exposures it's almost ready to go into peer review. So we're super excited about that. But now I want to talk about, but that's like, we're still relying on databases that are incomplete. What do we do if we want to look at these, do more agnostic, like because we don't really know what chemicals are in there. So we have been with a lot of this work is being done with Dimitri Abrahamson, who's at UCSF, using these high-resolution mass spectrometry to screen for chemical signatures in biological samples. And so, and I know you also do this at Hopkins. So as I said, we've been using LCMS, and we have, this is some work we did early on, and we've been expanding this work with more prenatal samples, but we were able to use this in 300 maternal blood samples and 300 cord blood samples. And this is just the method by which we do the high resolution mass spectrometry. But the point is that, and we have an LCQ top that does that, is that you can take the blood samples, you clean it up, and then you can scan them for chemical signatures that we match to a database, so that it's an a somewhat agnostic evaluation of chemicals that may be present in these blood samples. And so we published this. It's a little bit old now. I can't remember what year this is. The years go by so fast. 2021. Also, COVID kind of was a big interrupter. So this is some of the early work that we've done. We're able to use this to scan for chemicals, like I said, in blood samples of pregnant women. And which we hypothesized, is that we would identify chemicals that had not been identified previously. Either they weren't in these like product use databases, or they hadn't been identified in other databases, but that they were chemicals that were in the EPA dashboard. And so what we found was that, there's more details on this, which I'm not going to go into, but you can read the papers. But there's different levels of confirmation. So level 1 is we had a standard, level 2 is we use spectra, and then level 3 is just like, well, looks like there's the same structure. So the high confidence, medium, not so high confidence. And you can see that we can see a lot of different chemicals, from whether they're pesticides, flame retardants, PFAS, plasticizers, cosmetics. And then here's the ones where we have found these 55 chemicals that nobody has reported. And not surprisingly, while they're level 2, meaning we have some that we're reasonably sure they're there, we are reasonably sure we don't know where they're being used. So here's some examples. And they're so unusual. They don't actually have short, cute names like PFAS. Anyway, so the Stimularizer GA80, which is a plasticizer used in the production of plastic polymers, which is no surprise. And actually, we did this before microplastics became obviously an explosive issue that I'm sure you have people there dealing with, which I can talk about in the questions. And then this one, acetyl tetramethyl piperidine, blah, blah, blah. Anyway, it's used in personal care products. Fragrances, we saw a lot of fragrances in this. So you can see we can pick up these different types of chemicals that we would not have picked up if we had just done it, tried to identify what to measure first. And then we also found a couple PFAS. These actually are a little bit easier to measure because their fluorine signature means that there's typically not other interfering peaks or other things. It's an impurity of PFNA, and maybe also this other one comes from possibly surface protect textiles, food contact materials. So the other advantage of the non-targeted analysis is you can look for a non-targeted analysis is actually widely been used to do metabolomics, to look at molecules, in the body that are metabolites that have been produced from various biological activity. So we also got the metabolomics. So we have the exogenous chemicals, all the chemicals we found using the matching with the EPA database, but we could then link them to look at how those may be linked to different types of metabolomic or different metabolomic perturbations. And I'm just showing you one example of what we found, which is that in the maternal blood samples and the cord blood samples, we saw that these perfluorinated chemicals were linked to perturbations in fatty acid metabolism, which is consistent with what other studies have found. But I think this just shows the power of being able to use this to look at these metabolomic pathways that are helping us also move a little bit upstream to look at the health effect before, the earlier effect before we have to measure it downstream. And I just noted, this was published in 2021, but the NAS has concluded that there's sufficient evidence that these perfluorinated chemicals cause dyslipidemia in adults and children. So this is consistent with the literature. But what we could then do is say, well, what is another health outcome that's of important interest that's also related to fatty acid or lipid dysregulation, which is gestational diabetes. This is a really important health outcome. It's increasing among pregnancies in the United States. And it affects, I think, almost, like a third of pregnancies, and it can have important health consequences both for the mother and for the child. So we took that information and looked to see, well, we also, because we had this, group of pregnant women, but 300, we can look and see their gestational diabetes status. And indeed what we saw, so you could start with the exposures, link it to the metabolic profiles, and then look at the downstream consequence. And we saw that these PFAS, PFX, these different PFAS, we actually quantified some of these, and I won't go into the details because they're not with the standard, they're kind of with this other method that we've been using. And you can see that there's an increased odds of exposures in these and gestational diabetes. But we also saw this with two of these kind of plastic related chemicals as well, tridecanoic acid and octadecanoic acid. And they are both endogenous fatty acids, but they're also used in plastic production. So that was kind of interesting. Another thing that we learned, so you can learn a lot when you do the studies. So that's how we kind of like start at the kind of agnostic screen and then help us narrow down on exposures and outcomes of interest. Okay, so and then lastly, so we're focused on these multiple chemicals, susceptible periods of development, and then I just want to just briefly talk about we also have been in this cohort that we've been recruiting from for many years, been asking women during pregnancy about different stressors. So, things like food insecurity, whether they have chronic stress due to, they don't have a good social support network. Maybe they suffer certain types of discrimination. And this is work that Stephanie Ike did when she was a postdoc for us. She's at Emory now. I'm looking at PFAS and its relationship to fetal growth and stress. So a couple things that are really important about this. We measured PFAS in this cohort, and we could look at the PFAS together rather than individually. So that's really important because chemicals together can have a greater effect than alone. And then we can also look at psychosocial stress. Yes. So what we see is that there is an effect of PFAS on birth weight, and you can see the approach here that we did the weighting of them. This is and then the psychosocial stress alone decreases birth weight. PFAS alone decreases birth weight, and together they have a greater effect on birth weight. So she went on to do more work. If you want to see her other work, and this is actually published, it says in revision. She did other work looking at some of the mechanisms by which stress can act and how PFAS and stress can influence those mechanisms. So it's just another area. But the important point being that multiple chemical exposures and multiple stressors can have a greater effect on these birth outcomes, which is important to think about when we're looking at how are we going to address these chemical exposures. Okay, so I'm going to start to switch over to the work that we're doing to interpret this data. I'm like looking, oh, here's my time. So the other, it's like we can improve our ability to kind of screen for these chemicals, but what about the toxicity? Now I know we have cohort studies. It's a really important part of our research program, but ideally we would not have to wait for these health outcomes in people in order to identify toxicity and then address their toxicity through reducing exposures. So we also work with other people, particularly through our Earth Center, and Dr. Josh Robinson we collaborate with Dr. Josh Robinson, who has started the Center to Advance Toxicology and Chemical Hazard Assessment, which is essentially using more in vitro type tools to more rapidly screen for chemical exposures. And this is chemical health effects on different types of health outcomes. So in this case, he has a screening mechanism that he uses to screen for potential developmental neurotoxic effects. And I'm just going to briefly go through this because I want to get to the other part. So it's a human embryonic stem cell model, and he has screened based on viability and cell death, a number of different chemicals. And I feel like this is published, so you should just look this up. But I want to talk, so he can look for developmental neurotoxicity, but I want to talk about, and he identify compounds of high concern. And I just want to note that one of them is quaternary ammonium compounds. So if you remember back when we were doing the screening for echo, this is one of the chemicals that came up as being very important. It's normally thought of as a reproductive and developmental toxicant, a reproductive toxicant, but it's also coming up high as a potential neurodevelopmental toxicant. But I want to talk about, because I've also collaborated with Dr. Jennifer Fong as part of this work, and Dr. Patrick Allard, who's at UCLA, using this yeast screening assay that can screen for effects on meiosis, which is really important for reproductive success. You can also use a similar C. elegans. C. elegans are just a worm for doing the same screen. And the goal in this project was to use these screens independently and together to identify potential reproductive toxicants. And they worked pretty well. So we did the experiments. These are all published and these are accurate. And then modeled the benchmark dose 10, which means we modeled the dose response, looked at what was the exposure that resulted in a 10% effect, and then you can compare across all the different chemicals. So you can see how they rank in terms of toxicity and that we can screen hundreds of chemicals at a time. I just want to say that Jennifer has gone on to both look at also multiple chemical exposures as well as to do some concordance testing in mouse. She's doing some mouse work to verify some of these. But here's BPA right here, which we know is a reproductive toxicant. So this gives you an idea that there's a lot of chemicals that are less potent than BPA, but there's a good group right down here who are more potent. And in here are some of those quaternary ammonium compounds, as well as some flame retardant compounds. And that there's a match between these two and that they're color coded for different type plasticizers, quarks. So you can see there's a lot of quarks down here. The blue ones are pesticides, and then the ones up here tend to be more like flame retardants. So this is really great because I'm not going to go too much into this detail. This list, a little bit of this list was like based on prioritizing like we did with ECHO, but then some of it would be like, oh, let's look at the chemicals that are high priority for doing risk evaluations under TSCA. So we threw some of those in. So there's like kind of a different ways that we can look at this list. But I want to point out that we were able to compare this to mammalian data. Now, I just want to caveat, because she will caveat this by, they'll say this, that it turns out, and we can look at, and you can see there's like excellent agreement between the benchmark dose 10 for the animal, where they see reproductive effects in the animal, and then the yeast and the C. elegans. But I'm just going to go back. We're looking at up here at this end. It turns out that EPA's reproductive toxicity mammalian data doesn't cover all the stuff that probably is really a problem for us and is really focused up here. So that's kind of a problem. But you see here's BPA, but a lot of these are weaker reproductive toxicants. So malathion, DEET, TCEP. But I'm just saying it's pretty good agreement, almost like I cheated, but I didn't. We checked it many times because, of course, it seems too good to be true. So we're really excited about using this, and we're doing an actual, I'll talk about this in a minute. So how do we translate this data? So this gives you an overview, kind of the research we're doing and how we're kind of moving into trying to really do a more, to contribute more to the literature to understand a broader range of what the exposures are for these many, many chemicals and how they impact health. But what we really are very focused on is how do we make something meaningful? We know we have these chemicals. We know they're producing toxicity. How can we do a better job to prevent those harmful chemical exposures? And we really focus on policy because that's the structural change that leads to, that's the intervention that creates structural change that prevents exposure and works for the most people, and it can be set to be equitable so that people don't have to worry about an individual level. It just sets a bar for everybody. And by now you're probably thinking the problem seems impossible. It does seem very daunting. So I just want to go, sometimes you get to read like unusual books when you're a professor. Anyway, this is a really interesting book. It's a book about how the Surgeon General's report happened in 1964. So it's a report about the process of the first Surgeon General's report on smoking. And if you're, well, I really am interested in the process of how decision-making happens, because that's where we can have, how the decisions are being made and the rules by which the decisions are made influences what the end decision is. So it's really important to understand these processes and ensure they're fair and less subject to bias. So, and the reason I find this really amazing is because in the 1960s, tobacco was embedded in the US economy. I mean, people were smoking like crazy. Tobacco products were a third largest source of federal revenue. So they had a lot of money, and they were making billions of dollars in 1962. So this was a, embedded part of the economy. And And so then the first Surgeon General's report came out in pretty much the peak. And so the important part of this is that was when the science started to be solidified by an authoritative body that smoking causes cancer. And I mean, there was a lot of evidence before then, but it's really this authoritative body that comes out and says smoking causes cancer that then allows these different activities to happen, both citizen engagement. So the non-smokers' right movement came. There was a federal activity like bans on like cigarette taxes, a second Surgeon General's report, and then slowly over time, which is the number of cigarettes per capita, slowly over time, we see a decrease in smoking as people recognize the science, and then they also act on the science, whether it's engagement by citizens promoting this, that we need to reduce tobacco use, or the government responding by enacting laws, laws like banning smoking on airplanes, for example, and then low in workplaces. And now smoking is far decreased. It's not like it's zero, but it's far decreased. And then I'm going to talk about the role of the industry in this, but so I think we can learn something. We should learn from this. Also want to say that we've done public polling opinion, and people universally, they don't like toxic chemicals. It's like no matter where you live and what state, you agree that this is from, and we also did focus groups with blue collar workers and moms and young people, and basically everyone agrees that the companies and the government should do a better job about safeguarding, making sure that when we buy products or whatever we go into the store, that they don't have toxic chemicals that can make us sick. And I just think it's really important to point out that people think of they don't realize that when they go in the store and they buy a product, they think everything in it's been tested because they're used to pharmaceuticals, which do have a law that requires that they have to have safety and efficacy data before they can be prescribed. Manufactured chemicals do not. And so I think this point, people are so used to the federal government being involved in one aspect of their life, doesn't realize that they're not involved at all in the other aspect of their life. Okay, so I'm going to talk a little bit about what we've done to improve this, and I'm going to go back to the 90s because some of us started then. Anyway, so I just want to note that, things have changed over time. There was the World Wide Web, now we call it the internet, in the 90s. But I want to talk about when I was at EPA, I did evaluations. I was in the policy office, and I was one of the internal reviewers for the hazard and risk assessments that were part of the Integrated Risk Information System. That's the IRIS program. So IRIS is in the Office of Research and Development. They produce the authoritative evaluations of chemical toxicity, and then they put it out on this portal, and it's used by everybody. It's used for making regulatory decisions. It's used for making cleanup decisions. It's used by everything from local cleanup to global. It's just really considered a gold standard. But when I was involved at the time, this wasn't even an actual thing, because remember, in the 90s there wasn't web pages. But anyway, but one of the things that was really, I realized when I was working there, is that decisions were made like this. They were like narrative expert-based reviews. Everyone kind of got in this room, and then we all argued about, anyway, picked apart different things. And it wasn't, there was a good amount of science, but there was just really based on whoever was writing the document. It's better now. I just want to say that. But at the time, it was whoever was writing the document, there was some kind of like whatever their opinions were. So this resulted in a lot of cherry picking, and that was really not the way to do evaluation of the science. So when I got to UCSF, we started a process to be like, we should really have a more consistent, transparent approach to evaluating evidence. This had been done for cancer, was pretty good for cancer, but we didn't do this for all the other health effects besides cancer, all the things that are increasing in the population, like these neurodevelopmental effects or reproductive effects, or anyway, all of them. So this is another thing that happened when I was at EPA. Actually, this is a funny story. I'm going to tell it anyway, even though this is recorded. When I was at EPA and I first got there, and it was in the Clinton administration. So people were pretty excited because there'd been a lot of Republicans as president before that, except for that Jimmy Carter flip. And so people thought, oh, we're going to make a list of all the reproductive and developmental toxicants that EPA knows about. And so we started to, people were passing this list around on email. And then basically there was a group of people who stopped it all from happening. And somebody emailed and said, we have resisted this before and we're going to resist it again. And I was just like, why? But it turns out that there is a lot of resistance to really identifying chemicals, the toxicity of chemicals. Now, in the state of California, we have a law. We have to do that. We have to identify reproductive and developmental toxicants. So, and I think it's very useful because it helps us make decisions. So I wasn't at EPA. I was like, well, we're going to develop a method that improves upon what we've been doing and is based on what clinical medicine has gone through. Clinical medicine also went through this process where it was kind of just like people read whatever papers they wanted and then came up with their opinion, but it turned out that that can be biased. And they developed the Cochrane collaboration and GRADE, which provides a systematic and transparent method to evaluate the quality of the evidence. And the goal is to reduce bias, to provide a bottom line summary that then can be used to support decision making. And this was published as a navigation guide. The navigation guide has gone on to be propagated into different methods. So the National Toxicology Program published their method in 2013. I don't have IRIS on here, but IRIS also has a similar method because Chris Thayer went from NTP and to EPA, and IRIS is a pretty good method. And then we've published many different systematic reviews, and it's been endorsed by the NAS and used by WHO ILO. And then our most recent one is on microplastics. If we want to talk about that later, it's an ES&T. So I'm going to talk about prenatal PFAS and birth weight briefly. So the first systematic review did was on prenatal exposure to PFOA and effects on birth weight. And I'm not going to go through all the steps. You can read the papers. But basically, after putting all the data on the same scale, evaluating the quality of the evidence, and doing a meta-analysis, you could see both in the animals and in the humans that increasing PFOA exposure, this was really on PFOA, was associated with a small decrement in birth weight in both the animals and the humans. So we said that this was sufficient evidence that it was a reproductive toxicant and that it was known. And this turned out, I'm not going to go into the details, but there was a lot of consternation about this whole thing. But I just want to say that eventually the National Academy of Sciences also added this to their sufficient evidence of an association in their recent report, I think it was 2 years ago, on PFAS and doing clinical guidance. So this never would have happened if there had not been this initial systematic review, because a lot of these endpoints just get kind of left by the side and not really evaluated. And they basically took existing systematic reviews, evaluated their quality, and then identified whether they agreed with that. And so that, I'm going to talk about this first. That was then used in the new drinking water standard that EPA put out under the Biden administration to lower the amount of PFOA and PFAS allowed in the drinking water. And they calculated the benefits of that. And you can see right here that there's $175 million worth of improvement to birth weight. And that is because improved birth weight in infants means less infant mortality. This is all due to reducing infant mortality, which turned out, if you calculate this, was somewhere where between 8 to 10% of infant mortality in the United States could be improved. That's huge. And it's on par with bladder cancer and cardiovascular benefits. So the point being that if you create a mechanism by which the evidence can be summarized and used, it has huge value in the decision-making process. I just want to say that also we know that as we measure PFAS, that these regulatory activities lead to lower levels over time. So this is when there was a voluntary phase out. Manufacturers started moving away from PFAS. EPA announces a broader phase out. And you can see these are the levels. These are the levels that we measured in the ECHO consortium because we had pregnancies over this time period. So these types of activities matter, but they're not without their pushback. So this is a paper we published. We have at UCSF an industry documents library, which has internal industry documents from tobacco, chemicals, sugar, and we share opioids with Johns Hopkins University. And we did an analysis of the papers on PFAS, and we published this showing that the industry knew as early as 1961 that there was toxicity of PFAS, and nobody knew about it until there was a lawsuit back in 2000, and then this was revealed. So the industry basically will lie about the toxicity, and therefore to promote the continued production of their product over and profits over people's health. So I'm just gonna, because I think I'm at time. So I just want to say we've done a lot of work with clinical communities. This is work we do with the International Federation of Gynecology and Obstetricians. They make recommendations, including promoting policies, which we think is something we've done, which is really important. We also provide individual level information on our website. And then I just want to talk about the other component is that we do a lot of engagement around public policy. We do a lot of work around TSCA rulemaking. We've done public comments on all the risk evaluations they've done on the existing chemicals. We go and testify before the legislature on varying, when we're asked to, about how to use science. And then we actually have a training program, part of our P30, to help train scientists, community leaders, and healthcare providers about how do you make policy happen in a regulatory context focused on the state of California. And we did this. And I just want to say that we also have our Science Action Network, which works to connect scientists from around, well, both in the United States and globally. And you can participate in public comments, collaborate on initiatives to improve decision making. I know Keith's worked with us, and we do webinars and provide information on science policy news. And this is from the most recent work that we've done, which is to put together, we've been developing these white papers on what are the specific recipe for improving how decisions are made related to toxic chemicals. So we have recommendations around science integrity, what should be best available science, preserving and improving data, and ensuring environmental justice, and they're all available on our website. And going to end with the last thing, which I said, which was we've also recently launched the Center to End Corporate Harm, because now that we have all this really excellent data, and we know that the largest global burden of disease is from products that are made by corporations, and we know that corporations have strategies to promote their profits over the public's health, we need to treat corporations as a disease vector. So the new Center to End Corporate Harm is made up of faculty both inside UCSF and in collaborating institutions. We just launched it, and we have a website. You can sign up for our listserv. We'll be taking members who want to be participating, and we are together working to create solutions to rebalance the scales to protect health and democracy. So with that, I'm going to finish. I'm pretty sure you now know that environmental chemical exposures are everywhere and that they are impacting health. I didn't go into all of it, but we have a lot of just this amount of data and information we have now is so much improved, even in the last 20 years, that we have the opportunity both to do more research, but then to also advance solutions to reduce the burden of toxic chemical exposures. And I know that these are challenging times, but I think we have, I think people really care about this issue, so I'm still cautiously optimistic. And I just want to say this is not, I presented work that's done with many people, and we have a lot of really excellent faculty at UCSF who work with me, we work together. We have our Earth Center, we have collaborators outside. Some of the people on this call are my collaborators, so I just want to thank everyone, and this is probably not everyone. So and you can follow us on all our social media channels. So thank you. And I'm going to stop sharing.
Thank you so much, Tracey. That was awesome. Can we do our electronic round of applause? I know it's not as nice as hearing people in person, but imagine it.
Yeah, I'm imagining. Oh, that's a great song too.
It is. Well played. So I
just want to say I don't see any Hassan Piker on here, so just saying. This is good.
You don't see any. Yeah, good. All right. Well, I want to open it up for a couple of questions. We always like to invite our trainees to ask questions. Any of our trainees want to kick us off? They're being shy.
I know it's hard on Zoom. That's the problem.
It is hard on Zoom. All right, how about our faculty or anyone? We'll open it up more broadly. Oh, Mei Lee. Mei Lee is a trainee. Come on and ask.
Hi, thank you very much for such an awesome presentation. That was really interesting. I had a question about like the current mechanisms. I mean, these might even be changing, but like what you were talking a lot about dissemination of the science that we have. Perhaps we don't need more evidence, but like a better way to disseminate knowledge into the channels that would lead to some changes. So like what mechanisms exist now, like within federal and state regulatory bodies, like to act on the current toxicological evidence and other like environmental health evidence that we have? Maybe ways that are good and ways that you think need to be improved most immediately would be really helpful. Thanks.
Yeah. So I think the election had us do some self-reflection because I think there's two things about this. One is we need to be, or maybe three things. They're clear in our messaging, right? I think we tend to kind of still say, oh, maybe we don't know, but we actually know a lot about these toxic chemicals. At New England Journal of Medicine, I was asked to do something in New England Journal of Medicine, and I actually had to go through and look at all the systematic reviews and authoritative bodies that have been published on a lot of the chemicals that we study. And you know what? The evidence is really good on a lot of them. We can just say, we know these things cause, and then there's a table in there. You can say preterm birth, phthalates cause preterm birth. I mean, or metabolic disorders. So I think that we have to be more upfront about acknowledging that the evidence is good and the methods that we use are good to do that. That's one thing. The second is that we need to be talking to other, this is what we're going to be doing, is talking to other media channels. That's why I was asking people where they got their news, because, as I've said to other audiences, I love, the New York Times is, people are like, oh, we get quoted in the New York Times. Well, you know what? A lot of people are not reading the New York Times. Shocking. But so our goal is, and we're like in the middle of implementing this, but we need to be out in other media channels, talking in to other audiences that we normally would not talk to. Like he's going to go on Fox News, I hear, next week. So, I mean, I talked to so I have been deliberate when people, because we did this systematic review on microplastics. It was for a project for the state of California. So we've gotten a lot of requests to talk about that, and we'll talk to all kinds of media, and our goal is to look for these other media channels and be more engaged in them, because people are getting their news from many different sources. So that's really important. And then the third thing is, I do think it's really important to go bring this information. As Marcia knows, we've been, all the P30 centers have been getting together because we're really concerned about the funding to NIH, and particularly to NIEHS. So we've gotten together and put together fact sheets about why the work that we're doing is so critical, particularly, and I know the executive orders are not always fun reading, but the Make America Healthy executive order has some really important information in it that should be really part of our messaging, or it should be more about our messaging. So one of the things we do is put fact sheets together, and then we're encouraging people to go talk to their Congress people. And you know what? Because a lot of Congress people have no idea what this topic is. They really just don't know anything about it. And that's because we haven't been there. And I think even just like the small amount of education that we've done so far has been extremely helpful. And we have some ideas about more of that we're going to be covering on that. But I wanted to say one more thing about this, which was, I don't remember what it was. Anyway, so those are the three. I mean, if you're interested, the Science Action Network, we do public comments, like I said, on all the EPA, pretty much most of the EPA rulemakings under TSCA, and people can sign on or, participate in those at different levels. So, and that's, if you really want to know about all this stuff, read our public comments.
All right, we're going to do one more question, and then all the faculty are kicked out, and it's just students.
What about you, Keith? Are you going to be there?
I'm not. I'm kicking myself out.
Oh, okay.
It's going to be just you and students.
Okay, sounds good.
Ari.
Hello, Dr. Woodruff. Thank you for your talk. My question, it ties to Maylee's, that it's about risk communication. How do you communicate the evidence that is already quite intimidating for affected populations, like pregnant women, inundated with all the different risk factors? What have you considered in your communication so that the evidence is conveyed, but without fear?
Right. So I think, well, I'll just talk about the microplastics since that's something we did recently. So we did a systematic review on 3 different health effects from it's a rapid systematic review. So reproductive effects, effects on the gut, colon, and respiratory effects. And we found the conclusion was it was suspected. So when I talk to people, or we talk to people that were like, this is a suspected, reproductive toxicant. And, the people can make, so it's to be clear about whatever the level, and we know, and then there are choices that you can make to reduce your exposure. So, and a lot of those things that we have, and we have toxic matters, and we work with our clinical partners, a lot of those things to reduce your exposure or increase your resiliency are concurrent with what they're going to say anyway, which is eat lower on the food chain, eat a healthy diet, wash your hands before you eat, don't microwave in plastic. So a lot of the advice is try and keep the advice simple and doable. And then the last piece of evidence we give to people is that this is not your fault. This is not your fault. That's really important to tell people, because I don't have time to go into this, but a lot of this is like blame on you. You didn't exercise, you didn't eat a good diet. Well, a lot of those choices are not really are influenced by people's external environment. So you say it's not your fault. It's really about the fact that these products are sold to you or you have accessible without the proper testing. And, we encourage you to know that and also engage at the level that you can, even by voting. You can tell people to vote or support organizations that support their viewpoint. But I think it's really important to tell people. We have a whole, one of our collaborators does a report back on, do the biomonitoring and then report it back. It's a project with Silent Spring. It's really important to tell people because they want to know. And it's frustrating, but it helps also eventually lead them to be more engaged and empowered.
That's great. And Tracey, can I just add one thing to what you said too? I often find in situations where the affected people by whatever pollution we're talking about have very little that they can actually do to better their situation, especially in the case of air pollution. And I like to try and educate reporters that, I get that you want to give people actionable information to improve their situations, but it's important to not lose the story that they are not responsible for what they're experiencing.
Exactly.
There are other entities like the industry or the government who are not living up to their roles in protecting people from pollution. And so that's an important piece to keep in the mix too.
Yeah, I totally agree. And that is, whenever I do, because I get a lot of reporters who are like, what can I do? Or what can people do? And I'm like, but you have to remember, it's not your fault that it's really the government and these corporations who are doing this that are responsible for this. And we need to have better rules.
Right.
And enforcement of those rules. Yeah.
As Tracey was pointing out, many of the P30 centers have the community engagement pieces. And communities don't have a voice unless we, help them with that voice. And that's what many of the P30 centers are doing, is giving communities voice. And also letting them know about the harm. Many of the communities are aware, but they haven't been able to get any traction. But also there are many things that they're not aware of, which is helpful for us to share.
Right. I mean, I think it's hard because, exactly. Because it's like, that this thing next to you is making you sick, but you don't know, the mechanisms by which to make that change are very opaque, and it's hard to engage that. And having a scientist be there in addition to the community voices is really important. I think that's what, tobacco is a great example of that too.
Yeah.
So I totally agree. And that is, important. You guys do great work there.
Yeah. Well, thank you, Tracey. Great to see you. Hope to talk soon.